When we talk about alcohol use, it's really easy to fall back on simple labels. But in the worlds of medicine and psychology, the way experts classify it has gotten so much more sophisticated. Today, we're going to explore that evolution, moving from what was basically an on-off switch to a much more complex and honestly a much more revealing spectrum. So let's just dive right in with a question that seems pretty straightforward. Is there a real difference between alcohol abuse and alcohol dependence? Well, the answer really depends on who you ask, and more importantly, when you ask them. As we're about to see, the definitions have shifted dramatically over the years, painting a picture that's way more complex than you might think. So here's our roadmap for this explainer. First, we'll draw the lines between social drinking and at-risk behavior. Then, we'll dig into the clinical core of what dependence really means. After that, we'll get up to speed with today's modern diagnosis, the substance use disorder. And finally, we'll touch on how scientists have tried to profile different patterns of drinking. Let's get into it. Okay, let's start at the very beginning of this spectrum. Before we can even talk about where the risks begin, we first need to get a handle on what's considered, non-problematic. I want you to think of this like a ladder of increasing risk. You start on the ground floor with social or moderate drinking, which, by definition, doesn't cause any real impairment. The next rung up is what's called hazardous drinking, and that's where the risk of future problems starts to show up. And finally, you reach the top, harmful use, which is where that risk has become a reality, causing actual damage. Now, pay close attention to the key word here, risk. Hazardous drinking isn't defined by the problems you already have. It's all about a pattern that puts you at a high risk for future trouble. This is exactly what those screening questionnaires you might fill out at the doctor's office are trying to catch, that potential for problems down the road, hopefully early enough to do something about it. Okay, so the next step up from risk is harmful use. This term comes from the big international classification system, the ICD-10. And here, we're not talking about risk anymore. We are talking about documented, actual damage. This means real physical or mental health problems directly caused by alcohol. What's super interesting, though, is that this specific definition only looks at health. It actually excludes social problems like trouble at work or with your family. And this slide right here really shows two totally different ways of looking at the same issue. For years, the American Diagnostic Manual, the DSM-4, defined alcohol use by its social consequences, failing at work, getting into legal trouble. But at the same time, the international ICD-10 was defining harmful use by its direct impact on a person's health. It's like two different sets of glasses looking at the same problem, which, as you can imagine, could lead to very different conclusions. All right, let's move on and see how this all builds into something more severe. We're now moving past just harmful consequences and into a clinical concept called alcohol dependence syndrome. And this is where the idea of impaired control becomes absolutely central. This definition from back in 1976 was a complete game changer. It totally reframed the conversation. It said that dependence wasn't just about drinking a lot or having problems. No, it was a specific syndrome, a collection of symptoms that all point to one single core issue. A person has lost control over their drinking. So how do clinicians actually spot this syndrome? Well, the original model was built on 7 core elements that together define the state of dependence. Now, we're not going to break down all 7 of these, but some of them are probably going to sound pretty familiar. You've got increased tolerance, that's needing more and more alcohol just to get the same effect. Then there are withdrawal symptoms, that's the awful physical and mental rebound when you stop. And salience. That's when finding and using alcohol basically becomes the most important thing in a person's life. These are incredibly powerful signs. And listen, this wasn't just some vague idea. To actually get a formal diagnosis of dependence under these older models, you had to have experienced at least 3 of these 7 symptoms within the last year. It created a really clear clinical line in the sand. And that brings us right up to the modern era. Because, of course, the thinking on this has kept evolving, which led to the diagnostic model that's used today, and it represents a huge shift in how we classify these problems. So here is the big pivot. Before 2013, the diagnostic manual had those 2 separate boxes we talked about, abuse and dependence. You were either in one, the other, or neither. But then, in 2013, the DSM-5 just got rid of that separation entirely and combined them into a single unified diagnosis called substance use disorder, or SUD for short. So why the huge change? Well, experts finally realized that the 2-box system just didn't reflect reality. Alcohol-related problems don't work like a light switch that's just on or off. They exist on a continuum, a spectrum of severity, and this new model was designed to finally capture that nuance. And that really matters, because it allows for treatment that actually matches the level of the problem. And this is basically how the modern system works. A clinician looks at a list of symptoms, and instead of asking, is it abuse or dependence, they just ask, how many symptoms are there? If you have 2 or 3 symptoms, it's considered a mild SUD. 4 or 5, that's moderate. And if you have 6 or more, that indicates a severe substance use disorder. It's all one continuous spectrum. All right, for our last section, let's look beyond just the level of severity for a minute and explore a different question that researchers have been asking for a long time. Are there different types of problem drinkers? This is where we get into the world of typologies. This idea is definitely not new. Way back in the middle of the 20th century, a researcher named Jelinek came up with these 5 types. It was a really pioneering attempt to show that not all problem drinking looks the same. He was trying to separate patterns like a purely psychological dependence, what he called the alpha type, from patterns defined by a total loss of control, the gamma type. Now, a much more modern and really influential model is Cloninger subtypes. This model basically said there are 2 main pathways. You have type 1, which tends to show up later in life, after age 25. It affects both men and women, and it's often linked with anxiety. And then you have type 2, which usually starts before 25, mostly affects men, and is really strongly associated with things like impulsivity and novelty seeking. So if there's one thing to take away from all of this, it's this. Our understanding has made a profound journey. We've moved from a very simple black and white view of alcoholic versus non-alcoholic to a scientific, multifaceted spectrum that looks at risk, harm, dependence, severity, and even personality type. Which leaves us with a final thought to chew on. Knowing that alcohol use disorder isn't a simple on-off switch, but a really wide and varied continuum, how does that change the way we should think about it? And maybe more importantly, how should it change the way we all talk about it?